In terms of our speakers today, I'm going to open with Lynne Gordon. So Lynne's going to open the session, but I'll actually introduce Lynne last, just because I don't want to duplicate with the other speakers as well. So Lynne's going to open for us, and I'll introduce Lynne in a second. Then after Lynne's presentation, we're going to be joined by Lindsay Hobbs, who's joined us from the University of Bradford, and Lindsay's going to offer us a session on midwifery courses at university. After that, we're going to pass to Natalie Finch, and Natalie, also from the University of Bradford, is going to give us an introduction to university courses in nursing. But without further ado, if I can introduce our first speaker, please. And Lynne, feel free to get your slides ready just while I'm doing this introduction. And that is Lynne Gordon. Lynne is a senior lecturer at the University of Hertfordshire. And Lynne's going to provide an introduction to the allied health professions. So Lynne, without further ado, I'll pass the floor to you, please.
Welcome everybody, and thank you ever so much for joining us this afternoon. My name is Lynne Gordon, and I trained many years ago as a therapeutic radiographer. I'm going to come on to that later because I'm making that the career spotlight as part of this presentation, but I'm going to talk about all the allied health professions that can undertake degree courses so that you can get a feel for what your options are, as well as looking into medicine, dentistry and nursing, etc. So the first slide I'm going to show you is just to give you an idea of the variety of courses that are available to you. And you can see that I've put them into two columns. We have one column in blue and one column in black. And that's because some professions are regulated by a body called the Health and Care Professions Council, and those are all the ones in blue. Now, I haven't put every single profession that's regulated by the HCPC onto that list because some of those roles are not patient facing, and what I wanted to do was just to give you an idea of the sorts of roles that you can do in the health service where you would be face to face with a patient clinically and therefore really contributing to the health and care of those patients. Other professions not listed on there are things like people who work with hearing aid fitting, clinical scientists and biological scientists, and they're the people who do a lot of the testing and working out what's wrong with people behind the scenes, but they're not necessarily face to face with the patients. So there might be a few careers there that you're not familiar with. So I'll just go through a couple of them, and I'll put therapeutic radiographer at the top because that's my profession. Obviously, I'm a little bit biased. But a therapeutic radiographer is a cancer specialist, and I will come on to that when I do the career spotlight later. Paramedics, very much in the news at the moment, ferrying lots of patients to and from hospital because of the coronavirus situation. But as you go down the list, people who are really important to people who have had amputations or disfigurements, etc., are prosthetists and orthotists. So a prosthetist is somebody who will construct a body part that has been removed during surgery or maybe an amputated limb, etc. So they're really important people in helping our patients maintain function so that they can go about their normal daily lives. You might have a patient who maybe has lost an eye due to an accident or cancer, for example, and so a prosthetist might actually construct a fake eye, and they're really great artists because they have to completely match the opposite eye so that it looks the same in terms of colour, size and shape, etc. So it's a very skilled job. Orthoptists is to do with eyesight, so they work alongside opticians, and then you've got art, drama and music therapy. So with that particular career, you probably don't need as much science background as you would do with some of the other careers because it's more based in the arts. But again, these therapists work really well with a variety of people in order to help them recover from particular illnesses and conditions and cope better with normal life. The other list with midwives, nurses, psychologists, etc., those are all careers that are not regulated by the Healthcare Professions Council, but they will have their own regulatory bodies. So doctors through the General Medical Council, for example, nurses and midwives through the Nursing Midwifery Council. I'm sure the other speakers will talk to you about that anyway. Now, one of the things that I thought about was, if I'm looking for somebody to come onto my programme as an admissions tutor, what sort of qualities am I looking for? And I think probably key to any healthcare profession is those underpinning values for the NHS. These are things that we want anybody who works in the NHS to have. So even before we look at your academic profile and whether you're members of clubs and societies, etc., we want to know that you've got the personality, compassion and resilience to work in the NHS, face to face with people who are sometimes at the worst point in their lives. So if you have a look at this, there are 6 of them, and I think they're probably pretty common sense really, but working together, respect and dignity, commitment to quality of care, compassion, improving lives and everyone counts. And I think underpinning all of those for me is the ability to communicate and communicate effectively. So I'm looking for people who are a real people person. I'm looking for somebody who is able to talk one-to-one and have a really good conversation. And doesn't get stuck for words when they're talking to people. My students tell me I'm really gobby and I just carry on chatting, and I think that's a typical health professional would be able to do that, because being able to talk to your patients, you get an awful lot of information. Being able to look at the patient and read their body language is part of communication. And you'll probably notice that that's a lot more difficult over the internet than it is in a face-to-face situation, when you've done lots of webinars and Zooms and things. But it's a key component of any health programme that we're looking for. So when we're assessing applications for health programmes, we're looking at that whole rounded person. Yes, academic achievement is one part of that, but you know, if I had somebody who'd done a PhD in astrophysics and was the most intelligent person in the world, I wouldn't take them onto my degree if they couldn't communicate and empathise and be compassionate, because that's not the sort of person I want working with the patients in the future. And at the end of the day, my job is to provide part of that workforce in the future. So have a think of all those different attributes and values, and think about that list of careers that I showed you before and how they apply in each case. Now, one of the things that you'll be interested in is thinking about, well, okay, you've talked about the personal qualities, but what about the entry requirements? Now, this is going to vary from university to university, and almost a little bit between different courses as well. So first of all, we're looking for most courses in the allied health professions to have a really good GCSE profile. So that's looking grade C in the old scheme, a number 4 or above in the new scheme. And we want to see that you have aptitude across a range of subjects, because that tells us that you've just got that intellect and that the cognitive skills to be able to switch quickly from one topic to another. Depending on whether you're doing BTECs or A-levels with your sixth form studies, then we're looking for BTEC merit and distinction profile, and A-levels, a 96-point profile would be equivalent to 3 Cs at A-level. So it depends on which programme, how popular that programme is, as to what you'd be looking at. So currently at my university we have 112 points for my course, which is therapeutic radiography, but the diagnostic radiography, our sister course, is at 120 points. And that just is because radiotherapy is not such a well-known profession. People don't know about it. It's no less technical than the other one, but because diagnostic radiography gets more applicants, they can afford to push the points up a little bit. When we're thinking about the health degrees that you apply for, remember I said that all of the courses are regulated by the HCPC, and at the end of that, graduates will be able to register as a state registered professional. Because the HCPC regulates the courses, it means that the course content is very similar. There are specific things that we have to meet within our course content. So when you're making your university choices, it may come down to looking at which university you want to study at, rather than what the course content is going to be, because the course content will be very similar. It'll just be packaged in different ways in different universities. So do your research really carefully, visit a lot of universities either virtually or in person as much as you can to get a real feel of where you want to study. Not all universities offer all courses. For example, there are, I think, 11 institutions across the whole of the UK that offer radiotherapy, but there are 20, I think, that offer diagnostic radiography. So, you know, you might go to a particular university that's got a really good reputation for health courses, but then find out they don't offer the one that you're specifically interested in. So you are going to have to do quite a bit of research. Now, the extended projects there, we count the points in our programme for that. Some universities might not, but what that particular qualification shows me is that somebody is able to go away, do independent research, it extends your cognitive skills, and it's just an added extra that I really like to see if people can fit that into their study schedule. So it's well worth doing. And if you can do it on a topic that is related to your chosen future profession, that's going to be beneficial to you as well. So we've talked about the key qualities for health careers. We've talked about communication, interest in people, but the other thing that is really important is that you have to treat everybody equally, whether they are the same cultural background as you, the same religion as you or not. All of those things are really important. We cannot judge people. We have to treat everybody equally. If somebody who's a criminal comes in for treatment, they are still a person and they still deserve the best possible care that we can give them. Most of the professions are going to involve some form of technical expertise, and that will vary from profession to profession. So in my profession, this is a picture down here on the bottom right hand corner. You can see we scan patients, we interpret images, as well as the diagnostic radiographers do. So you're going to learn that on the course. With other professions, it might be using the equipment that they use to manufacture the prostheses. With physiotherapy, there might be respiratory equipment that you have to get handle on. So lots of different skills to learn. In most of these professions, you have to be a team worker and you have to be physically fit. The average radiographer, whether therapeutic or diagnostic, will be walking around about 14,000 steps per day. So if you're not fit when you start, you certainly will be as you go along. And I'm pretty sure my nursing colleagues would agree with that as well. Now, one of the things that you're interested as well, you get your degree, what do you do with it? You might go into your chosen profession and then after a few years you think, well, I might want to change. So I thought I'd just put a little bit about career progression in as well. So this lady in the middle is a lady called Suzanne Rastrick, and she is the current UK head of the Allied Health Professions Council. Very important person. She communicates with the government about all sorts of policy, and she started life as an occupational therapist. So you might want to go into government regions. You might want to do education or lecturing, so research. This is in radiography. This is a lady called Rachel Harris, and she's the head of research at the Society of Radiographers, but she started life as a therapeutic radiographer. This is one of my colleagues who works as a consultant radiographer at Peterborough District Hospital. Again, she started as a therapeutic radiographer, but she now works alongside the consultant documents. She has her own caseload. And so there are clinical careers as well as the management pathways. Kevin, another one of my graduates from years ago, he works now at University College London, and he's now Director of Cancer Services. So he's gone the management route rather than the clinical route. And then Laura, another one of my students, she's done some work with Public Health England, and so she's kind of a clinical communicator with Public Health England, so looking at a lot of cancer strategies, smoking related education stuff as well. There's also health agency work, manufacture and sales. Sorry, I'm really conscious of the time, so I'm speeding up a little bit. So the career spotlight in therapeutic radiography, not many people have heard about this, which is why I decided to do the spotlight here. And basically, a therapeutic radiographer is the only profession in the health service that will deal with a cancer patient from day one of their student training. So they really are the experts in cancer and its management. So the first image, this is part of the treatment planning. So you start off seeing patients after they've been newly diagnosed and you plan their treatment. What this image is showing is where the beams of radiation are being focused in order to hit the cancer, which is covered by this blue line here. This is a linear accelerator, so this is the kind of really technical equipment that you'll learn to use during a program in radiotherapy. And what we're looking for is delivering that really high dose radiation very, very accurately. We also need to be able to interpret medical images. So this is a reconstructed CT scan in 3 dimensions. If this was on our computers, it would spin round and we'd be able to look at different things. But what this image here is showing is the spinal cord in yellow, the whole of the lung in blue, and then the red bit is isolating a cancer within that lung. So we need to know an awful lot about anatomy in a lot of detail. But as I said at the beginning, a lot of the work of any health professional is communication, and as radiographers we do an awful lot of talking to our patients to make sure that they're getting on all right with their treatment, and making sure that they get the advice and support that they need. This is the latest high-tech equipment, so it does a similar thing to the linear accelerator. This is called a cyberknife. Looks a bit like a car factory robot because that's where the technology originated, but it just means it's an extra accurate way of treating cancers. So all health professions that have content regulated by the Healthcare Professionals Council can be studied at university. So of course you need to be careful of your choice. You come into these courses because they're vocational, so you won't put on your UCAS form, oh, I'll apply for radiotherapy and I'll apply for physiotherapy and I'll apply for diagnostic. You'll come in and you'll know exactly what course you want to do. A therapeutic radiographer would not be happy working in diagnostic radiography and vice versa. Do as much research as you possibly can. Make sure that you've looked at all the options carefully. My background, I thought I wanted to be a dentist. I spent a day with my own dentist having a look at the work that they did. I was thoroughly bored. And then I went to my careers library. I found a little leaflet, just a 2-side leaflet about radiography, spent a day in a diagnostic department and a day in a therapy department. And as soon as I'd spent an hour in the therapy department, I was absolutely hooked, and that's been my career for 30 years. Excuse me, although teaching these days. Make sure when you're preparing for interviews that you consider those NHS values and how you might meet them. Think about times you've worked in teams, think about how you've worked independently, what your response to stress and coping is, because you're going to see some people with some quite, you know, sort of like upsetting conditions when you work in any part of a hospital. And if you really want more information about a particular career, contact the admissions tutors at whichever universities you're interested in, because they are the people who can give you the expert knowledge on what happens within their particular institution. The final thing is be prepared for very hard work. With any of the health degrees, you're going to do what's called a compressed timetable, because you've got to fit in about 17 weeks of academic work and 17 weeks of clinical practice work each year. So as compared to somebody who is doing a geography degree, you'll be doing much more out in placement, you'll have less holiday time. So you need to think about how you're going to support yourself financially through uni as well, and where your placements are. So we have placements, for example, as far south as Portsmouth at the moment, and as close to Hatfield, where I'm based, as Northampton and just in North London. So just bear in mind all the logistics around your chosen course, as well as the other things that you might think about, like social life, etc. So that's me finished. I hope that's been a useful and very brief zoom through allied health professions. I've tried to keep it as general as I can, but obviously if you've got any specific questions, I'll ask them in the chat in just a moment. Thank you.
Thank you very much, Lynn. There should be an option just on your page, Lynn, just to click stop share, and it'll come back to me. Thank you very much, Lynn. That's a fantastic introduction to a subject area that I don't know how you covered it in such a short period of time, Lynn, but you managed to. So thank you very much.
Trust me, it's difficult to be brief when you're used to a 3-hour lecture.
if you've got absolutely any questions for Lynn, I can see there's one question already waiting for you, Lynn.
Yeah, I'll get on with
please
those
do send them over. So Lynn, if you don't mind, just you can just mute yourself now. Stop video. That's wonderful. So now if I can introduce our second speaker, which is Lindsay Hobbs. I run a lot of these events, as you know, and one of the most popular questions I get is can we have a session about midwifery? So I'm pleased to say here it is. Lindsay is going to provide an introduction to midwifery as a subject area. In terms of her role, she's a lecturer at the University of Bradford, but I believe she's also an admissions tutor as well. So if you're interested in midwifery courses, she's going to be sharing some fantastic wise tips with you. So without further ado, Lindsay, I'll pass the floor to you, please.
Thank you very much. I'm very much looking forward to doing this session. I've got 10 minutes to take you on a whistle-top tour through midwifery even. So I'll do my best. I will be available afterwards. So if you do have questions, then do please put them on the chat. Okay, so I'm a midwife. I've been a midwife for 30 years. I fell into midwifery after a career in nursing. I was nursing for about 9 years and moved to a different part of the country. Fancied a change and discovered midwifery, and the minute I started, I never looked back. So, is midwifery for you? What is a midwife? Midwife means with woman, and what that means is that you're working with women on a daily basis. You are supporting women through pre-pregnancy, pregnancy, birth, postnatally, and in the early weeks of life. So you're covering quite a broad area and quite a compressed length of time working with women and families, and you'll be providing skilled, knowledgeable and compassionate care to those women. Many of the values that Lynne has highlighted in her talk apply to midwifery as well. So when you apply, what we will be looking for are people who recognise those and can demonstrate those NHS values. The title midwife is protected in law, and what that actually means is that only a midwife or a registered doctor can provide care for a woman during the birth of her baby. So it's a very privileged role as well. And you know, you play a key role in also reducing maternal and newborn mortality and morbidity. So it's a very important role because you're making a vital contribution to women, their families, their babies, to their survival right across the globe. Midwives, you know, it's an important role right across the world, not just in the UK, but everywhere. So what's it like being a midwife? Being a midwife is exciting. No 2 days are ever the same. No 2 women are the same. No 2 births are the same. No 2 families are the same. So each day you work will be different from the next. And that can be very exciting, but it can also be very challenging as well. Because not, you know, having said that not all births are the same, also it means that, you know, it's not all sweetness and light, because not every woman's story is the same, and there can be some challenging things that you will come across where you will need to support women and provide really good care for them. So that will involve problem solving, it may involve some leadership attributes. It also involves very much working as part of a team. Although midwives can be the lead professional in providing care and supporting women, and they are fully accountable for all the care and decisions that they make and the care that they provide, you are very much working as part of a team, because there will be women who have other needs as well. They may have mental health needs, they may have medical problems that they will need support with. There could be, you know, many different needs where other members of the team will need to be involved in that care. And as the midwife, you will probably be the person that is coordinating the this for the woman. You will need to advocate for women as well. And what that means is you may need to speak up for women where they feel unable to speak up for themselves. And I thought it was really interesting when Lynne said that she gets called gobby. Midwives are the same. Midwives are gobby as well. But midwives are also known as being a bit deviant as well. And the reason that they have that image is because midwives may need to support women who want alternative types of care. So it may be that a woman wants to have her and she's been advised not to. The midwife still has to provide care for that woman, and she has to provide skilled care to enable the woman to have the safest possible birth as is possible. And she may need to speak up for that woman and say, well, actually, you know, this woman wants this provision of care. How can we provide it? So what sort of attributes do you need to be a midwife? Many of these are the same as what Lynne was saying in her talk. There are the NHS values in there. There's courage, there's compassion. You need to be a really good communicator. You need to be committed to your work as well. And you will also need to be competent. And the 3 years that you study for your degree, you will be learning the competencies, proficiencies and skills of a registered midwife. So when it comes to the point of registration after the 3 years, then you will be able to provide all the skills needed for a woman wherever she is on her childbearing journey. Some of these you will already have, and some of these you will develop whilst you're studying for your degree. But additionally, you will learn to develop intuition. An example of that is when you are caring for women during the birth, very quickly you learn to use all your senses to be able to assess whether everything is going well for the woman or whether she may need some additional care or have additional needs that need responding to. And during your university degree, you are expected to provide care for at least 40 women and be present for the birth. And during that time, you will develop skills in learning from what you see, from what you smell, what you sense, you know, all those senses you will be using when you're caring for women. And this can be very challenging, and you will need to develop quite strong emotional and mental strength to enable you to deal with it. And that's where the team comes in, because the team is there to support you. And Lynne was talking about some of this when she was saying that you need to have energy and you need to have strength to pursue a career in the health service. And that is because it's a fast-paced environment. People present many different challenges, and it's exactly the same with women. You will meet women from all walks of life. You will meet women that are part of a family. You will meet women who are on their own. You will come across safeguarding issues. You may come across asylum seekers, women who are substance users, and this will challenge you, and this will, you know, make you think a bit more about, about you and about, how you make judgments. And one of the key things is having respect for women across all walks of life, having respect for diversity, and also being non-judgmental as well. And also as well, you have to be pretty adaptable. Occasionally you may be looking after a woman, say she's giving birth, and she may suddenly decide that she changes her plan, and you will need to adapt very quickly to whatever it is that that woman wants. So in midwifery, it's a 3-year study for degree and dual registration. This is pretty similar for most universities throughout the UK. So do check when you're looking at universities where you want to study about the length of the programme. But normally it will be 3 weeks study, 45 weeks of the year. We are regulated by the Nursing and Midwifery Council, who state that 50% of that time is in university learning the theoretical components, and 50% of the time is in practice, which is where you'll be in the clinical environment and being supported by midwives as you learn the skills that you need. You're studying for two things, which is why it's 45 weeks. You're studying for your registration as a midwife with the Nursing and Midwifery Council, but you're also studying for your midwifery degree as well. So as you can imagine, that is going to take up a lot of your time. You will not get the long summer weeks that students studying non-related, non-health degrees get. You will be working for most of the year with just your 7 weeks holiday. Once you register as a midwife, there are lots of different areas that you can work in. You could work in the hospital environment. That might mean being on labour ward, on the antenatal or postnatal ward, or maybe an antenatal clinic. You can work in the community. There's a big move for midwives to provide continuity of care for women and continuity of carer. So that would mean you would work in the community and you would have your own caseload of women for whom you would provide the majority of their care. You could work in specialist areas. For example, you may have an interest in women with diabetes, so you may work in that area, or you may have an interest in substance misuse and you may support women who substance misuse. And that was my role for many years and I very much enjoyed it. You may choose to work in a birth centre, which might run alongside a normal maternity service in a hospital, or it may stand on its own. You could work in sexual health, you could work in research, and there are many midwives performing a lot of research at the moment. I'm currently looking at language in maternity services, so I'm doing research alongside working as a lecturer as well. So you could go into education. Or you could also do further study, which Lynne highlighted in her talk. And that might involve doing a master's degree, or it might involve doing doing a PhD or doctoral research. And that is midwifery in a nutshell. So if you do have any questions, please do put them in the question and answer box. And I'm around for the rest of this session to be able to answer them for you. Thank you very much for listening.
Thank you, Lindsay. Excellent introduction to midwifery. Again, I don't know how you got through so much in such little time, but really appreciate that. Lindsay, if you don't mind, there should be an option just to click stop share, which will then come back to me on the screen.
Got it.
Fantastic, thank you. Right, and as Lindsay said, she will be on hand in the Q&A, and there's been lots of questions which we've tried to answer as best as we can during your session, Lindsay, so no doubt the Q&A will get very busy now as well. If I can now introduce our final speaker, please, and that's Natalie Finch, who again is joining us from the University of Bradford. Feel free, Natalie, to get your presentation ready just while I'm doing it, if that helps. Natalie is a lecturer over at the University of Bradford, and very kindly, Natalie is going to do a session on nursing for us. Her speciality, I believe, is mental health nursing, actually, I think, Natalie, but you're going to give us a broad introduction to nursing. So, Natalie, without further ado, take it away.
Hello, everybody, and I'm absolutely delighted to have the opportunity to speak with you today about careers in nursing. We could probably talk for 2 hours about nursing as a journey as a student and then as a career. So what I thought would be most useful to do today would be to consider the 4 different fields of nursing, because when you make your application to UCAS, you'll be asked which area of nursing you would like to study. And so I thought it might be helpful to talk about those different areas, what you can expect to do within those areas, and then the common traits that will help you to succeed in those professions, and also to consider those in the context of your application to university and beyond. I'll just start off by saying that all 4 fields of nursing are incredibly rich, rewarding, diverse areas in which to focus your career. So hopefully by looking at each in turn today, it will help you to think about where your skills and passion might lie. So start off with talking about adult nursing, and this is probably when you see TV shows like 24 Hours in A&E or Casualty and things like that. This is what you'll be thinking about when you see an adult nurse. So as the name suggests, you'll be treating and caring for people from young adulthood right through to end-of-life care in terms of physical health. And you'll find adult nurses working in a real variety of settings. So wherever healthcare is delivered, you'll find adult nurses. So hospitals, GP surgeries, in community settings, such as district nursing teams who might visit the home. But you'll also find them in other different settings, such as care homes, nursing homes, and prisons, and many more in between. And they will be part of a team that manages physical health conditions that range from the tip of your head, so neurological conditions in your brain, down to the tips of your toes, so musculoskeletal systems, and everything in between. So there's an absolutely fantastic opportunity there to find out what it is you're interested in, and to really shape your career up around that. So are you interested in how the heart works? Are you interested in dealing with emergencies? Are you interested in dealing with cancer? The list is really endless, and the great thing about adult nursing is that you potentially have the option to try lots of different things until you find the career that's quite right for you. Adult nurses work in teams, so being a team player is particularly important. However, it's really important to consider that actually you're not just part of a team, you will often be required to lead a team of healthcare professionals as an adult nurse. And so it's really worth thinking now about whether that's something you're interested in and whether you see yourself as this leader, as someone who can take on those responsibilities. Once you've qualified as an adult nurse, the world is your oyster in terms of further training and career progression. So lots of postgraduate study available. You might decide to become an advanced practitioner, or you might decide to become a district nurse, or you might want to be able to prescribe medicines. These are just a small snapshot of some of the courses you might choose to go on and do after you've qualified as an adult nurse. And really, these different options give you fantastic opportunity for career progression. So when you qualify, you'll be a staff nurse, but there are great opportunities as you move through the healthcare system to work all the way up to a nurse consultant, which is a really senior post should your aspirations be that lofty. So that's adult nursing. Just move slide. I've got some problems with my slides. There we go, children's nursing. So again, this is a nurse that you may well see when you watch TV shows, and quite a widely acknowledged role of a nurse. And this is really where you treat and care for babies, young children, and young people. So that's from minutes after a baby is born up until sometimes around 19 years of age as children transition into adult services. So you might be looking after a baby who's literally just arrived into the world and has a heart condition. You might be looking after young children who have cancer, or you might be dealing with a teenager who's broken a limb in an accident, and everything in between. But this is really a job for people that particularly enjoy those relationships with young children and inevitably with their families. When you're looking after young people, you have to consider everybody that's around that child. And so you need to be able to communicate not only with the children, but with their families, who are often very concerned and worried and require as much management as the child themselves. So again, primarily the children's nurse will focus on physical health conditions, but there's more and more recognition of the fact that mental health certainly has a huge impact on physical health. And so it's the role of the children's nurse to not only understand the body and how a child's body works, but also to understand something about how a child develops and grows and their brain works, and those things all come together to produce optimum health for a child. So again, you might find children's nurses working in all the places you'd imagine, so the hospitals, in GP surgeries, with community teams, but there's also, again, lots of opportunity for further study to develop and enhance your career. So many children's nurses go on to train to be health visitors or school nurses and provide those specialist roles. There is also a large part of children's nursing, which is about safeguarding, which is about recognising risk and vulnerability and acting on that. And there's certainly opportunities to develop your career along those lines. Sorry, I've skipped forward. Having some real slide problems here. There we go, thank you. So, learning disability nursing. Now, learning disability nursing is one of the less visible career pathways within nursing. It's not as widely seen or recognised in our society, which is a real shame because our learning disability colleagues do such a fantastic job. So the role of the learning disability nurse, as is probably given away in the title, is that they work with people with learning disabilities and their families to provide really highly personalised care. Learning disability nursing is slightly different in that the disabilities that service users within this group experience are not reversible. So people are not going to recover from their learning disabilities. So the role of the learning disability nurse is really about helping to find ways to live life as fully as possible. And that's very unique for each person. But very rewarding. And this kind of role really requires somebody who is a great relationship builder, who wants to work with people and get to know them over a very long period of time. So it can take a long time for people to make changes within a learning disability setting. And so it is all about relationship building and working hard to achieve progress, really. Again, working in a variety of settings. Not so much a hospital. You're less likely to find learning disability nurses in a general hospital, but you will find them in assisted living centres, day centres, care homes, within family homes, lots of different scope within the community to work with people. And it's really about a partnership way of working. So not only are you working in a team with other healthcare professionals, with family, but you're also working with other agencies and other services. So there might be lots of liaison with social services and things like that around funding, around care packages. So you really need to be somebody who can cope with that kind of multi-agency approach. There we go. Mental health nursing. Last but not least, certainly not least, this is my field of nursing and one that I feel very passionately about. So mental health nurses work with people from a very, very young age, so from young children right through end of life care, so people living with dementia and in the final stages of their lives. Again, you'll find mental health nurses in hospitals, in communities, but also in specialist settings. So again, in prisons, in treatment centres, in detox and rehab. And my background is in substance use and people with serious mental illness. So you might be working with people who are experiencing psychosis, they may have mood disorders, they may have anxiety, they may have experienced trauma and be living with the side effects of that. We work with people who are in mental health crisis, who might be suicidal, but then we go on to work with people to promote well-being and recovery and to help people lead the lives that they want to have. Mental health nurses also work within a multi-professional team, but because of the largely community-based nature of mental health nursing, you do have to be comfortable with a high degree of autonomy and feel quite comfortable in being an independent decision maker and in control of your own workload. And it's definitely not for everybody, but it is a skill that you learn as you move on in your career. Also an area with fantastic scope for specialism and career progression, particularly as mental health becomes more commonly understood, more widespread. We're seeing more and more services becoming available for people with mental health needs, and we need mental health nurses to work within them. So I just wanted to touch on the personal qualities that will stand you in good stead to become a nurse in any of the 4 fields. And my colleagues who've spoken already have touched on them, so I won't labour them too much. But it's really important in all fields of nursing that you are able to communicate well. So that means communicating on lots of different levels with lots of different people. It means being able to adapt and adjust your communication style to meet the needs of the people that you're working alongside. And you need to be able to communicate your passion and just how much you care for what you're doing, because nursing is certainly a job where you need that care and you need that drive and you need that compassion to keep going back every day, because as Lindsay touched on in her presentation, no 2 days are the same. There are many joys, but there are many challenges within nursing, and you certainly need to be resilient in order to be able to come back every day fresh, to meet that day's challenges. So it's really about being a resilient person who's up for the challenge, who's ready to problem solve, and who has a good sense of humour. Really important for nurses is that one. It's about being organised, it's about having a practical approach to what you do, and being able to work with colleagues and other people around you. And they're on the presentation, so I won't labour them too much, other than to say, when you're making your application to university, that's in your UCAS form and at your interview, we want to see that you've considered these things. You've considered why you think you'd be a good nurse. So when you write a personal statement and when you come in for interview, don't just tell us that you're compassionate or that you care or that you're kind. It's really easy to find out that those are the things we want you to say on a form, but what we want you to do is to demonstrate to us how you're kind, how you're compassionate. So really give some thought to examples that show us that you're able to do that. So it's really important to think about those key skills and how they translate in your application to university. So we do say that we like people to have some experience in a care setting, and this can be really difficult for people. We recognise this, particularly if you're at school or college. It's not always easy to pick up that healthcare experience. And so I just wanted to touch on that today, and it's about thinking really, really widely. And as an admissions tutor, I really like to see that you know, you've thought about the skills you might use in a healthcare setting, and you think about how they apply to your life now. So, you know, has there been a time when at school you've supported a friend who was really upset about something? If you have, then tell us about that, but tell us how you did it. So, you know, did you use your listening skills? Did you need to signpost that person to extra help and support? You know, did you take the person to a quiet space? Did you tell them that, you know, that they could trust you? Just give us some examples as to how you've achieved those things. And that really shines through, and that's the difference between a mediocre personal statement, an interview, and an absolutely excellent personal statement. So just to reiterate that, think about the qualities that we've talked about today, and then think about how you can demonstrate those to an admissions tutor in your application. I'm finished there. I will hang around if people have questions. I'm more than happy to answer them. Thank you.